Now for medical rounds, the past weekend marked the 36th anniversary of the first successful heart transplant at Hartford Hospital. And since then, the hospital has now performed 469 heart transplants, improving the quality of life for patients and their families profoundly. Here to talk about the innovation is Dr. Jonathan Hammond. He is a cardiac transplant surgeon at Hartford Hospital. Doctor, welcome, and tell us, how has heart transplant technology changed over the last 30+ years?
Well, thank you. It's interesting that the actual operation and the cutting and sewing involved with the transplant itself hasn't changed that much. But in the last few years, there have been a number of innovations that have really helped the transplant scene. Traditionally, when we recovered a heart, we put it on ice and then brought it from the donor to the recipient. But that's a little bit crude, and it's a little bit like asking somebody to hold their breath for a minute and then run a 100-yard dash. It can be a little tough to do. So now we have a device that allows us to continuously pump blood into the heart, keeping the heart beating while it's being transplanted, and allowing it to arrive in better shape and ready to roll, as it were, when it arrives. The other area where there have been great advances has been in the technology of pumps that we use to keep people alive whose hearts are failing. This can come in the form of temporary support, which can resuscitate somebody and make them a candidate for a transplant, or durable long-term support with a battery-powered implantable device that can let people lead a completely free and unencumbered life outside the hospital while they're waiting for their transplant.
Yeah, and Doctor, what do all these advancements mean for the patient? Must make it easier.
Well, sure. With the pump that pumps the heart and keeps it beating, it means that we can accept a heart that will come from a greater distance without worrying about that it will be compromised with the time it's outside of the body. That means we can get hearts quicker to sicker patients, and so their waiting time will be much shorter. With the durable pumps, that means that patients can live many years of active life outside the hospital. And with the temporary pumps, it can take somebody who's literally dying and make them a transplant candidate.
Wow. You know, quickly, just before we have to let you go, in this time of COVID, are there concerns now with heart transplant surgery?
Absolutely. The virus can be particularly hard on anybody who's ill, and somebody with heart failure is vulnerable to the effects of COVID. And also, patients who've been transplanted have their immune system suppressed to keep their bodies from rejecting the organs. So they're vulnerable. So given this, every donor is screened, every recipient is screened when they come into the hospital. And of course, everybody gets meticulous care to prevent exposure after the transplant.
Dr. Hammond, happy Thanksgiving to you, and thank you all for the amazing work that you do there.
Thank you. It's been a pleasure.
For more information, you can visit hartfordhospital.org/transplant.